Thank you everybody for joining here. I think it's really important my involvement with the hidden opponent. I love being on the medical board just as a different perspective to the medical board itself, being a physical therapist. Although, like right away, you don't technically see myself as someone kind of dealing with the mental health side. Um, Physical injuries can really unmask mental health. Um, Disorders or limitations or just struggles honestly in everyday life. So I think what's really important is just giving you a little bit of taste into my background, things I've learned as a healthcare professional throughout my career in helping athletes navigate this space. The hidden opponent obviously helps so many different student athletes and students in all different college spaces really bring awareness to mental health and how they can it's resources for the community, and I'm super happy all of you guys are on here today to just learn a little bit more about what you can do to spread awareness. And then also, really looking out for your student athletes as well, and also just injuries in general. You don't have to be an athlete to get injured, but everyone, and anyone who does get injured as well, it can take a big toll on your body and your mind. So we're going to dive into that today. So I'm Dr. Shannon Will. I'm the owner of Willpower PT. It's a sports physical therapy clinic in Baltimore, Maryland. And so I've grown the clinic to, a handful of employees and staff. It's in a big strength and conditioning facility, so you'll see some different pictures here today. I treat high school, college, and professional athletes. And I think the main thing that I'm really proud of is that our clinic, a lot of people come to us when they don't feel like they're getting the attention, they're not being listened to, and that they're really, really fearful about returning back to sports. So sometimes people go to other practices and come to us because of our model. We're all one-on-one. We don't double anyone. We have time in between each patient to make sure that I'm documenting what's going on. I might be texting the strength coach, texting the coach, texting the athletic trainer. So just making sure that the athlete is supported and well rounded in their care. At other clinics I've worked in the past, truthfully, like you just don't have the time and the capacity as a physical therapist to manage three people coming in the same hour, and then also texting their coaches, their parents, and then honestly, the athlete or the patient suffers because of the lack of time because the clinic's trying to make money off me as a therapist. So designing my clinic, I wanted to make sure that patient is put first. And you'll kind of see that throughout my presentation today. Okay, so obviously I talked about, advocating, educating you guys today, and hopefully this provides some support for the extended community on campus for college students. Okay, so so injury is super common for the majority of athletes. Whether this is a minor soreness, a muscle strain you're trying to play through, or a more significant injury requiring PT or a career-ending injury. Injury is unavoidable, right? So even injury comes with physical change, but also psychological change. We are developing into a year-round athlete. You see this in different sports now. There's club sports. Before it was more rec focused when I used to play, but regardless, there's just more and more things to do. Everyone's got their own agility coach, their strength trainer. There's so much stuff that kids are signing up for. Some of that's even a money grab too. And so it's really important to realize that sometimes it's the year-round athletes that are just going all in on one sport that are sometimes getting more injured than being a more well-rounded athlete. So it's really important for me as a therapist to understand their routine, including school, practice, and games. And then realizing how injury is going to affect that athlete, given if this is lacrosse and this is their main sport, they play it all year round. If it's basketball, if it's football, whatever that is, we got to understand that. And what happens during injury? So the tissues of the musculoskeletal system, they respond through a process of damage and repair. And that's just even with normal exercise. This is how your muscles get bigger, called hypertrophy. So, when an athlete is recovering from an injury or surgery, tissue is already compromised. This requires more structured attention and programming to restore the range of motion and also the strength. And so, injuries or surgery, or both of them combined, can create detraining and an atrophy effect. So, the psychological impact of sports injuries. Okay, so injuries have a huge effect on athletes beyond just the physical pain and limitations. Um, the mental impact of rehab is incredibly underestimated as it plays a crucial role in the athlete's recovery and the performance. Physical injuries unmask psychological responses here. It causes lasting effects on how you perceive your injury through all stages of rehab, and it ultimately can delay performance and return to sport. So that's incredibly important as well. Is that even if you physically feel ready, you might be very fearful about your injury, and you act very guarded. So I think that's really important here too. Is talking about that with my patients about what are you nervous about? What do you want to be more aggressive in? What drill can we break down and really talk about how you can be confident with each of those components there. So we're kind of hitting on all these just different buckets really. We have the physical bucket. We have, maybe the quad is atrophied. We got to get that leg bigger, right? Maybe the movement pattern, they're shifting off of the leg. They're very fearful about loading that leg, right? Resistance training. We need to get them stronger and faster and powerful and explosive. Confidence, getting back into playing their position and what their position needs, and then also gaining confidence in the sport itself, in their positional demands. Maybe they're going back to being that leader on the team, that captain, right? Okay, psychological responses to injury. So we're going to dive into that just a little bit deeper. So we're going to go over the common sports injuries. So I see a lot of ACL tears, meniscus tears, shoulder labrum injuries, hamstring strain, quad strain, hip flexor groin, ankle, shin splints, low back pain, chronic soreness, and then just honestly, just very poor management of fatigue. So especially with that year-round athlete, just all the soreness that just adds up because there's 6 practices a week for 3 months in a row. It's just the body doesn't have time to rest and cover. So following an injury, first an athlete must process the medical information about the injury. So the doctor, the physical therapist, there's so much information that people like to give you about the injury. You could feel very lost and alone and kind of anxious about this because you're getting so much input about your injury and what you should be doing about it. Everyone's got an opinion. Um, it can be an emotional roller coaster right from the beginning, and you can be unprepared of what questions to ask and are you at risk for future injury. So even if you're having a little bit of soreness or little aches and pains, now do you feel at risk for maybe something bigger, kind of in the future? And that's always, kind of in the back of your mind. So, post-injury stages of coping, denial, right? Why did this happen to me? Was I not prepared? Was I not strong enough? Did my strength coach not prepare me enough? There's always, are we putting blame on other people? Are we putting blame on ourselves? That's kind of a period, definitely. Isolation and shame. You're getting kicked out of your routine. You feel there might be a feeling of failure and that you disappointed yourself, disappointed your coaches or parents, and then you also have fear of re-injury. Um, a huge impact on your confidence, your performance. Can I get back to pre-injury levels? Can I regain status back on my team? Am I going to be able to play in college? There's so much demand mentally and physically on your bodies, and that ultimately is your athletic career there. So one, I think your feelings are very valid. I think it's I let my patients kind of sit there, talk it through. A lot of crying, it can sometimes happens in my office. You can be talking and laughing about something, and then it can get kind of emotional. And so I just think it's really important to feel that and be upset about it, and then let's create a plan and kind of move past that initial emotion. And other emotions might come up, but I think it's important to feel that first kind of overwhelming feeling of, denial and uncertainty. Okay. Acceptance is really important. So having a realistic perspective, it's important to accept that you're hurt. Recovery may be slow and difficult, but we will need to use that determination that made you a great athlete to get you back to your level of performance. So accepting it, and then early movement, gaining, just little wins every day is really important. And then we want to make sure that we're checking in on our friends that are injured, checking in on our coworkers or colleagues, because we don't want that perpetuated denial. So that inability to handle stress. Exercise is such a powerful way to release stress. When you take that away from someone, especially a lower extremity injury, a lot of times things manifest because we can't control our stress. So we want to find ways that that athlete or that patient can still get the stress out pretty much. So modifying exercises is really important. Helping find a way to handle stress. Exercise produces endorphins, which ultimately lead to decreased stress. Okay, so psychological responses needing additional medical support. So just making sure that we are identifying within our friends, hey, what might they be feeling, and might what might be a red flag. So I have that up in the corner, the red flag area. I'm not stating that by any means I'm a psychologist or a psychiatrist, but I have great colleagues that are friends that I'm always referring people to if one of these signs are kind of happening with one of my patients in person. Okay, so after an injury you may experience stages of grief, that's denial, anger, bargaining, depression, and then finally acceptance. Um, so I like to ask athletes questions about their motivation during the day. Do they have changes in their appetite? Are they sleeping well? Are they disengaged from hanging out with their friends, from schoolwork, from activities? So I'm really trying to ask about their full routine and not just try to get them simply, let's just get your quad stronger. Let's really dive into the full capacity of getting you back to peak performance. And that happens with mental performance as well. Like we said, we're kind of tapping into all of these different things here. Loss of identity is such a huge one. Decreased self-esteem and self-doubt. Sports is such a huge source of identity for us. If you are a football player, a soccer player, a field hockey player, sometimes everything is revolved around that sport. And it's really important to make sure you have an identity outside of sport. For one, injuries might happen post college if you don't go professional wise. You will have to find hobbies, and it's really important to continue to seek outlets that just bring happiness to your life, and making sure that you can check in on your friends and provide another outlet for them as well. Okay, feeling of worthlessness, the depression, being very sad, constantly checking in with your friends, and the family members checking in. You always want to make sure that just as a friend, just kind of checking in over text if they're going through something hard like that. Sometimes you might notice maybe some of your friends have disordered eating. Sometimes that's common with females or males, really. And I think that what's really hard is that when you are injured, you are unable to exercise. So sometimes you might gain weight or lose weight. And that feeling about not being able to control your body when you once played sports and didn't think about it, sometimes that hyper control on eating is something that I see clinically. And so I like to word that as more as, food is fuel for your body during this time. Although it's not peak performance and you're running and you're burning calories, your body is working so diligently to heal the injured tissue, even though you feel like it's not your normal movement. So I like to word, I like to be able to refer them to some type of sports nutritionist, but at the same time, talking about how food is fuel for the state of life. Talking about sleep disturbance, irritability as well. Sometimes athletes get really frustrated if a rep is not absolutely perfect. I think it's good to have some imperfect reps, so then say your knee can tolerate these imperfect demands of sport. So even as a clinician, I'm looking for the awareness of form, but also realizing the knee should be able to tolerate different stresses. I also think, especially in the college environment, there is substance abuse, weed, alcohol, vaping, cocaine, binge drinking, gambling. So sometimes when you don't have, you're not playing, you're not practicing, you're not participating in games, even though you're there. Maybe your friends might resort to more drinking. And so that's something to just have conversations about, talking to the coach about, checking on your friends once again. Anxiety and stress, number 9 there. Anxiety about what the future holds, right? Um, so I think anxiety is a big one, and that's something that we, are talking about throughout our care. Fear, we talked about earlier a couple times, of re-injury, acceptance back into the team, losing the position on your team as well. And these are signs that I definitely want to refer to some other members of the medical board. You guys have met Dr. T on the medical board. He's a big person that I refer my athletes to and even bounce ideas off of. And even if they don't want to go directly that route, or they don't live close to him, he has a circle that can broaden who can help that athlete or that patient. So people coming into me, I have people that I trust that I want to make sure that my patients have access to, and that's why that I'm on the hidden opponent board too, because I also provide, the hidden opponent gives them resources as well that I like to refer my athletes to, even just the homepage of the website. Okay, so everyday strategies for mental rehabilitation. These are some things that I think are really hitting home, and things that you can check in on yourself and your friends and your teammates. We try not to rush the process before you're physically and mentally ready to go back, because injury risk is so much higher, and that can cause more future mental performance blocks. So here's a few techniques to tackle the rehab process at any stage. Like we talked about earlier, acceptance of the plan ahead, right? Making sure that all the expectations is set out. Especially as a healthcare provider, I like to talk about the unknowns. So if an ACL athlete comes in and it's injured, I'm not going to tell them that they're going to play sports the next day. If they ask me that, can I run in a month? It, that's not going to happen. That's not a typical plan of care, right? So setting expectations, and not just time expectations, but really function, right? Because it's really about based on the function of the knee, if they can get back to running their sports, and less about, okay, at 7 weeks, you have to be here. Because if they don't get there, it's not their fault. It just might take a little bit more time given the function of the knee. So I set very clear expectations for the athlete and their families. Attitude is a big one. We have to adjust the perspective. You will be stronger and a smarter athlete after injury. If you haven't been to a physical therapist before, you're going to learn so much about your body that when you come back from injury, a lot of my athletes come back and say that they are even stronger, especially mentally after this, because they've gone through such intense, diligent exercise programming, and really being optimistic about the journey together. We're building resilience. They have the willpower, which is the name of my company, to continue to keep going. Number three, setting clear and realistic goals is kind of what I just tapped into there. The other thing is that not all physical therapists really care as much as other people. You have a choice in your healthcare. If you do not like your doctor or PT, go somewhere else and find someone that you have a good rapport with, a good relationship with. You will always come back to them. They are in your circle, and I definitely recommend seeking someone, not just when you're injured, but even being proactive about that. So, um, in your rehab, kind of going back to that, we're celebrating successes, we're gaining momentum. I want to make sure that reassurance is key. The patient should not feel behind when they're exactly where they should be at in their place of rehab, and making the specific goals relate to their patient, to the athlete's why. So, why am I giving single leg squats? It's like, okay, this is boring. It's a single leg squat. I like to describe the single leg squat as the basis of running. We have to have that stability at an angle on that single leg when we're cutting, and we have to train it here and add weight and progress it. So I like to kind of, add that little bit in of education, and even while we might be talking about the weekend, talking about the exercise, but making sure you're always going back to why we are doing things. Um, okay, sorry, distracted here. Advocating for yourself, asking questions. Not all PTs are the same. Ask what you want to know. You have to advocate for yourself with doctors, with PTs, with your athletic trainers. Learn more about your injury and your journey and your plan. Establish a routine. Encourage your friends that are injured, or yourself. Wake up at the same time. Go to practice. Be part of the routine. Be part of everyone else's routine. Part of this is when you lose routine, you lose that self awareness of just scheduling, about time management. Other things can kind of slip. So I think routine is so important. Wake up at the same time, still eat breakfast at the same time, um, go to practice, go to the games, be present, talk to your coaches, still be a leader on that team, and show that you care about all the other teammates, because they might go through this in the future as well. I also think finding some other passions and some other hobbies, as you might have a little bit more time on your hands, that's important. Focusing on your schoolwork, also very important. Getting involved in communities like Hidden Opponent, also a great way to just grow your community and feel supported and support others. Staying social kind of adds into that. Taking control of your rehab. Even though you don't feel, sometimes it's like, okay, the physical therapist might kind of know what's going on with my knee better. You can still take control of the controllables. What, Dr. T, kind of likes to say that as well. You can continue to eat healthy, go to sleep on time, hydrate, implement recovery days. These are things that we can control, and then let's hone on them. in on them. Being on time, right? Being on time is super crucial. Take initiative in your care, in your rehab. Be present, right? That's super important. I think going off number 8 right now, going on vacation. A lot of my younger athletes sometimes just need a full break. Talking in strength and conditioning cycles here, just in simplest terms, it's you have a say you play soccer, basketball, and lacrosse. There are normal breaks, maybe 2 or 3 months. You have 2 weeks in between, the holidays or whatever, you're back into the next season. With year-round sports, you never get a break. And I think the 2 weeks are really crucial to kind of reset, refocus on what's ahead, and let your body have some relaxation and recovery. Sometimes families just need to take a vacation. They don't need to go to every single club, sport, function, whatever it is, all summer. So sometimes I like to say that you guys got to get out of here, kind of clear your head and reset as a family. That will decrease the accumulative fatigue. Have tough conversations. Be honest with your provider. So I had one athlete come in, and he was saying he fell off a curb and his knee was all screwed up. And I was like, "There's no way he fell off a curb and it looks this bad." And then he finally told me that he fell off the lifeguard stand, twisted his leg, whatever. He was having fun. I literally do not care what happened, but I cannot figure out your injury if you do not tell the truth, right? I think that's a great example to just be like, that's a safe space when you're with a healthcare provider. Hopefully, you feel safe and they make you feel safe in that conversation. But we are here to help you. We're not here to judge you. We are trying to get to the bottom of the injury. So just being honest and open, we want to support you in your journey. And finding other ways to exercise while you're injured. So if you have a knee injury, you can still do upper body work. If you can't run, you can still do a lot of bike sprints. You can still get that type of input to the body and still feel like you're even sweating, even just kind of releasing that stress, like we talked about. Even just bringing a friend to the gym or bringing having your teammates there. That's really important. You want to stay involved with the team as much as possible. Um, Stop rushing, right? Stop comparing yourself to others. I do know, there's some clinics in our area that post time frames. They post an athlete on their Instagram and they're like, this guy's 7 weeks out from surgery and he's really 4 months out, but he's, doing jumps and he's running. And then people are comparing themselves to that. But it is literally fake news. And I hate that that's going around on social media, but I do see that happen from even companies that promote things that just are not true. So I think, having a very good balance with social media is really key, especially when, being injured or going through something mentally, or even just kind of struggling with something. Social media should be, you should kind of close out the tabs on your phone. And sometimes you go away from that being like, I just feel odd. If that is the case, making sure that you hide people's stories that just make you feel weird. Flooding your Instagram with, maybe positive accounts and or maybe taking a break altogether. Social media can be really powerful, and let's make it a positive environment. And then don't ignore the pain. Your body is telling you something when the topic of pushing through the pain is not accurate. Maybe push through fatigue, but not pain. Your body's trying to tell you something. Okay, so these are more structured strategies for mental rehabilitation. Those were kind of my everyday strategies that I think are really important to hone in on, that I found clinically. But here are more structured strategies. So mindfulness and meditation, really important. I think yoga is um, an awesome outlet as well for athletes, and if there's a place close by that you can go to with your friends. Visualization, especially when being injured, you might not be able to be at a practice, but watching film, watching practice, seeing, like, going through those movements, that's a really great mental visualization there. And don't underestimate that. This is why mental practice and going through the steps can really address performance blocks as well. Seeking treatment and accepting help. You want to find an identity outside of being an athlete. If you're struggling with that, it's very common to seek a sports therapist. And I think that you could really benefit from that as well. And honestly, even just learning more about yourself is going to make you successful in business. Even me being a business owner, I have to be mentally strong to wear a lot of different hats. So even just starting out by, initiating somebody that you trust in that you can tap into later in life, you are mentally getting stronger here. Okay, so if we obviously addressed a lot of different topics here, but if you or someone you know is struggling, there is help. You are not alone. Tell a friend, tell a coach, tell a health professional. Here are the different hotlines here, and then also hit an opponent. I think has some great resources, some great blogs too. To just if someone's feeling alone, that's a great place to start. Okay, so building your sports medicine team. And so this is kind of diving a little bit more into what I do every day. So I'd like to make sure that the athlete is supported with their medical doctor, their PT, their psychologist, a nutritionist, and the athletic trainer. And I think that, and strength coach, I would add in there too. I'll kind of hit on that as well. But a strong support system and environment can positively impact the athlete's mental health. So, excuse me. All of these practitioners should communicate and collaborate regarding changes in the patient's presentation. And please let me know if anybody has questions while we're doing this. Okay, so I'll even just send the medical doctor a text or their PA. And so even just that brief communication, I think email is so stiff sometimes. And honestly just not as quick. So sometimes that texting or that phone call will be really powerful. And then I think what's really important to address here is that athletes can get confused when they hear conflicting opinions from health professionals. So I think it's really important that I never put down another health professional. They might be speaking to a very specific limitation. I think it's valuable to listen, but then I'm the person that sees my athlete 3 times a week. I hear all about their life. I hear a lot of stuff. I become, very in a great way, building great rapport about the patient because I see them more often than any other health professional. So it's important to get all of those not conflicting opinions, but maybe different opinions and adding them into the care to make sure that not they don't feel that one person was like, oh, what he said, I'm kind of mad he said that about my care. He or she. It's more of I'm acknowledging that the health professional had a different take on it, and how can we develop that from there. Okay, so I think the lack of communication amongst this sports medicine team can delay recovery and prevent the peak performance at the end. So, especially tapping into the coach and the athletic trainer, making sure they're not just sitting on the bench, but they progress back into practice and back into play. And this is good to make sure, all of this communication is really key at taking the time for your friends and your teammates. And in my case, my patients and my athletes and their families. And as a patient, you want to, as we talked about being an advocate for yourself, you're playing a crucial process in communication because you are the middleman. You are the one person going to all of these appointments and reporting back to all these people what's going on. So you want to also assist with that communication as the athlete. Okay, building rapport and trust. We talked about that. Getting feedback from each of the different medical health providers here. I think the other thing too, I just want to tell you kind of a clinical example about building rapport. Is a patient told me that they wanted to switch PTs since they began lying to the past PT. That PT had been like, no, you can't go back to play. They felt like they could go back and play, so he was playing but just lying to the PT. I'm happy that they were able to share that with me. But I do think, I mean, just being an athlete in the past, being kind of hard headed, I, me as a healthcare professional, if I'm like, nope, you cannot play. In some cases, they cannot, and we're mostly on the same page there. But it is a waste of time. Um, if I am telling them no, but they're doing something anyway, I'm putting the athlete in more risk. If they are going to go out and play, I'd rather have modifications and parameters there. So then they are safe to play instead of going all in. Well, I'm talking here. Well, good. Okay. So I think having honest conversations about the purpose, the understanding, and the direction of where we're going to go. There's a couple different ways that we can modify play. One is the frequency per week. So going back into practices, do you need to go to 5 practices the whole week? No, maybe let's pick 3. Okay, maybe you haven't gone through a whole hour and a half practice. Let's start with a half hour, high intensity though. Let's see how that is. Let's stop while we're ahead. Those are great conversations to have because we build momentum. We don't have pain. Great, builds confidence. Every single time we check that box, add more time, add more intensity, add more days of the week. Now they're more confident, more confident. Instead of they go, balls to the walls, full practice all 3 days, and now their knee is just blown up and irritated. Now we just decrease that confidence. Okay, this also builds trust as well. Um, And then in terms of feedback, I want my patients to give constructive feedback. Is it too easy? Is it too hard? I think this is really important. This is why that I don't double any people. This is why that I have 45 minutes to an hour with every one of my patients. It's important for me to see their facial expressions when they're doing an exercise. Is it too easy? Are they fooling around? Are they intentional? Intent is such a huge thing. We could be talking about the weekend, about what they did, and they are not focusing on how hard I want them to push into the ground, how high I want them to jump. So cueing is really important for me as a therapist to make sure I tap back in. There's a good relationship of that rapport, but also intentional direction back to the exercise and our goal with each rep, each set, and the overall plan for that day, but also the plan for the week. I also think staying with one therapist is key. Sometimes at all these different clinics, you go from transferring between 3 different therapists. I don't even have to look at the note. I know what we did. I know what corner of the gym we are at. So, when I can, we like to keep our patients to each provider because that care is just you progress them so much faster. Because a lot of times when you switch therapists, nobody wants to push them that hard to piss them off, so then the other therapist has to deal with it. So they're just being underloaded. Okay, let's see. Great. Okay, building your home team. Coaches are such key figures in sports environments. If athletes seek their approval and acknowledgement of their coaches. So I just want you to kind of look at that, look at that page there, and just coaches are incredibly important to being an active part of the team. Okay. So if coaches are more into injury prevention, preventative methods, talking about nutrition, recovery, sleep, that kind of stuff, the athlete is more open to communicating about their bodies to the coach, less fearful of being injury, doubting themselves. So I do, you guys will be coaches one day, and want to coach potentially, especially with being maybe former athletes or student athletes. So just remember, as a coach, it's really important to check in um, on your athletes and making sure the teammates and the captains of the team are also checking in. And so I think that comes from the coaches too, to being that leader, and captains too, being the leader. Same with the hidden opponent here. You guys are leaders in your community. You have a duty to help support, even though you might be stressed out with your own life. You want to make sure you're checking in on people. Okay, we talked about the strength and conditioning coach and trainers, making sure we're tapping in everybody into the sports medicine team here. Parents, I think the main thing for parents too is sometimes with younger athletes, parents kind of chime in and they talk over their kids. Sometimes the kids kind of look up to their parent to just tell them, but the kid is experiencing that injury. So even with my youth athletes, I always ask them directly that for them to have confidence confiding in someone other than their parents. I think parents too, it's really important to say, I love watching you play instead of like, wow, that was a great win, a great loss. Instead of focusing on you know, um, the win or loss, it's about the process. Okay, we talk about teammates a lot, being a teammate in life, being a friend in life, right? You're always surrounding yourself with the best circle you can that build you up. Being very selfish with your time, in a good way, and time is valuable. So you want friends to encourage you, to understand your goals, to understand your healing process there, to understand what you're going through. Okay, so every athlete will sustain some type of injury in their career. It is important to have a plan in place to deal with these setbacks, not just physical, but mental, even financial too, can make recovery less scary and daunting. So, making sure that you have your circle, before you have an injury. We know that those little aches and pains and injuries may happen. So just making sure that you reach out to a healthcare professional and start to develop your team to support you if anything happens in life. Um, Mental rehabilitation is such a vital aspect of the recovery process for athletes dealing with any type of sports injuries here. And so I hope you guys were able to tap into kind of the other side that I experience on a day-to-day basis as a healthcare professional trying to support them through their physical journey. Okay, so everybody loves a good comeback story, right? So remember what makes you an athlete. You have a strong mental foundation. You're able to deal with obstacles, discipline, having a positive attitude, a strong work ethic, strategic thinking, resilience, willpower, motivation, right? You can deal with whatever comes next. You've already displayed these attributes in the way that you are an athlete, in the way that you lead your team, and how you're a supportive teammate. And you can carry those traits over to your rehab process, and honestly, just in life in general. A lot of student athletes go on to create amazing business careers and entrepreneurship opportunities. So all those qualities, really carry on throughout life, and this will not get you down. You will only become smarter athlete after this, and just a more well-rounded person about your body and what you can mentally withstand, and that mental resilience as well. Okay, well, good. I hope everybody enjoyed the presentation. I definitely left a couple, some minutes here for some questions if we have them.
Yeah, thank you so much, Dr. Shannon. I want to encourage everyone either feel free to unmute and ask a question, put it in the chat, and we can quickly discuss. I think to kick us off, while people, if anyone's thinking of their questions, Dr. Shannon, what do you say? What do you think would be the best way to support a teammate through their injury, especially if coaches aren't super supportive?
Yeah, I think we talked about that on like kind of that whole slide is making sure that you're checking in, even if it's just a text to be like, "Hey, I'm thinking of you. Um, can I bring over some coffee and bagels tomorrow morning and just see how you're doing or whatever." I think even just asking them to go do something not even related to sports, I think is good to just get their mind off it. So even though sometimes you see each other so often, with practice and stuff like that, going out and getting coffee or wherever you guys like to go on campus. I think it's just a nice way to check in on your teammates without it being in one of the sports facilities, which can be a little bit overwhelming.
Thank you. Does anyone else have any other questions?
I had a question regarding kind of like if you had any tips about trusting your body, and like kind of avoiding hyperfixation in body parts post injury, like once you're back healthy.
So being hyper focused, just like hypersensitive to everything.
Yeah.
Yeah, I think that's a good question just because sometimes it's sore, it's painful, you get kind of fearful when you feel anything in that knee really, or knee, I'm kind of describing it as a knee. But in the joint itself, yes, hypersensitivity is something to progress. That's something that I track as well. Are they very sensitive to just even my touch, right? Anything manual therapy wise. I think just with exercises, finding things that do not irritate them and building confidence there before I throw something in that, might be a little bit too aggressive. So I think just getting those small wins and doing things in the beginning, if you feel really hypersensitive, just do the things that you're confident with. And, maybe you get into the gym and do, an hour of things that that won't irritate it, but still is really great for your overall goal. And then you can progress more when you're with that one-on-one healthcare professional.
Thank you.
Hey, any other questions? I have one that was sent to me in a message, so we can ask that one, but I want to give anyone the floor if they would like to ask it now. So, one question that came to me was for not necessarily related to injury recovery, but more so the profession that you work in. How would
Yeah.
you recommend current students kind of get ready if they're thinking about going to PT school? Like, what opportunities do you think are important for them to take advantage of if they're thinking about PT as a career path?
Yeah, so I went to Maryland and I was a student athletic trainer and I got to see I worked with a different sports team every semester. And so, in the sports medicine department, you can kind of apply to be a student athletic trainer. That's an awesome way to get to know the demands of a student athlete, the different sports, learning about the different sports. Um, excuse me, learning about different sports, the athletic trainer and the coaches and the staff is always communicating. So you're just like in the environment, learning about the orthopedic environment there. So I think that's an awesome way to just, in a fun way, it counted as a class. It was an easy A. I came one time, and it counted as a 4 credit course. So make it count toward your your semester. But that was an awesome opportunity in undergrad to prepare for a PT school.